Hi and welcome. Joe Valenzuela with Vista Mutual Insurance Services. Let's talk about how to choose a Part D plan. Now, first of all, you need to understand what a Part D plan is. There's a couple different ways to get them. What we're talking about here is kind of both ways, but a little bit more focused on standalone prescription drug plans. They can come as standalone, meaning you either have another type of coverage or you just have prescription drug coverage, like a supplement plan, or they can come as a part of a Medicare Advantage plan. Combined. So those are called MAPDs, Medicare Advantage with prescription drug programs. And most Medicare Advantage programs will include a Part D, and some don't. So Part D was designed just to help you cover the expensive cost of medications. So they're basically plans that Medicare sets the minimum standard for, and then private insurance companies offer to the public, and then you're able to enroll into them and get your coverage administered by that private health insurance company. But Medicare still has to approve them, and they have to meet the minimum standards. So it's prescription drug coverage. Now, what you need to know about Part D is that if you're coming off of an employer plan, usually with the generic medications, you may be paying even less than your employer plan. But a lot of the times with the brand name medications, your employer plan may cover them at a higher value, meaning they're going to cover more and you're going to pay less with your employer plan. So it's really something to think about, and this can be people's highest expense on Medicare type plans is prescription drugs. So it's really important that you evaluate your coverage based on this criteria. First, you need to assess your current medication needs. So take a look at your medications, ensure that you are still needing to take all of them. Sometimes we have a box or bin of medications that have really old medications that we don't take anymore. So you need to assess that and maybe even have a conversation with your doctor, explaining to them that you're going to be transitioning to a Medicare type plan and that you want to control cost, and to see if there's any alternatives to what you're taking if they're expensive brand name medications. Now, you don't have to just assess your current needs, but your possible future needs. And this can be difficult because you don't always know what's going to happen. But just know that there are some medications out there that cost $10,000 a month to fill. So you never want to be caught in a situation where you don't have at least a minimum coverage in place to cover you if something goes really wrong. Plus, if you don't have minimum coverage in place and you're eligible for it and no other coverage in place, you will get a penalty, 1% per month that you're eligible and chose not to get it. So although you can choose not to, you will be penalized for doing so. There's a really good tool that you can type in your medications, and then it will show you a rough estimate of how much your annual cost will be. And it's on the Medicare Plan Finder. You can find it at medicare.gov. Now, you can also do this by calling one of our agents, Vista Mutual Insurance Services. We can look these up for you, map out the entire year, and even give you a more detailed sheet than what's on Medicare Plan Finder or medicare.gov. But it's a great resource for the general public just to go in, look at what's available for you, type in your medications and the dosages you take. Make sure that you're very, very accurate here. There could be one small little acronym at the end of your medication that completely changes what the cost would be. So make sure you're putting that in as accurately as possible, and the dosage amount as well. You want to compare those costs. Each plan has different costs associated with it, different co-payments, different levels of coverage, and even different formularies, the list of covered medications that or the list that's used to show which medications they cover. That's what's called a formulary. So the Plan Finder will help you compare those costs. It should give you the lowest costing option at the top. That's also most popular. We can do it by a number of different criteria. We can do highest star rating, lowest premium, lowest total overall cost, highest formulary amount. So there's a couple other things that we can do for you. But on the Plan Finder, you can get a really good sense of what your costs will be per medication. This will help you check the formulary, and it's imperative that you do this. Now, you can do this manually as well, just by going to the company's websites and clicking on your area, usually by typing in your zip code, finding plans, and then looking at the actual formulary. Now, some plans will allow you to put your medications in just like Medicare.gov or the Medicare Plan Finder. But other plans will have you manually look at the formulary. You'll look at your medication, see what tier it's on, and then do the calculations yourself. This helps you check the formulary. It's good to also have a downloaded copy of that. This is something that I always send to my clients. Not necessarily the paper version because it's huge and out of date as soon as it's printed, but the manual copy or a digital copy of the like a PDF version of the formulary, just so that in the future you have a medication and it's really high, you can tell your doctor, here's my formulary. Can you find an alternative for me that is not so high? So it's imperative to compare the costs by using the formulary, and you can use those tools to do that, or you can do it manually, or you can give us a call and we'll do it for you, all for free. Now, one thing that you want to consider when you're doing this is your pharmacy that you're using. And most people do not consider this as a factor. They don't think it's a factor. See, plans have preferred and non-preferred pharmacies, and you'll get a lower cost share for going to a preferred pharmacy. So if you are using CVS or Walgreens or Safeway or whatever you're using, and you want to continue to use that, you like the pharmacist or they're just really good customer service, then you're going to want to make sure that you pick a plan that has a preferred pharmacy. That's the one you use. If you don't, you're going to run into higher co-payments, and it runs into a situation where you'll complain because you thought things were lower. So it's important to think about where you get your prescriptions. If you want to continue to get them there, or if you really don't have a preference, then you can just use that company's preferred pharmacy. Now, the companies will also offer mail order, and usually you're going to get a discounted rate for doing mail order. That's usually from a pharmacy benefit manager or directly from the company itself, depending on their contracts and how things are set up. But they'll have, usually right on the back of your card, a way to contact your mail order pharmacy company and get 90 or 100-day supplies through the mail. Quite often they'll do, 2 months for 1 month, or put a tier. And when we say tiers, formularies are all based on tiers. So we like to say the higher the tier, the more tiers. And only because as you go up in tiers, usually the cost goes up. So there's different plans that have the same medication, even on different tiers. So that's why you have to compare all this stuff. Now, the pharmacy network is a huge consideration, and you also want to look at the star rating. Now, this isn't as big as the pharmacies and the other things that we talked about. Star ratings on Medicare.gov, Medicare has a star rating system. They rate plans from 1 to 5 stars based on a number of different criteria. I think it's about 56 different metrics. A lot of it has to do with claims and processing and time, getting things out in a timely manner. And even a component of it is a survey from customers asking how they feel about that company. There's not many medication plans that get over 3-star ratings. So don't put too much emphasis in this unless the plan is underneath a 3-star. If they're 2.5 or 2-star, that's when you know there may be some issues there. But anything over 3-star is pretty standard. So look at the star rating, but take it with a small grain of salt. Now, when we're considering our future needs, it's imperative to look at the overall picture. And it's great to have a positive attitude and outlook about your health and your outcomes, but 90% of all of our health expenses are spent within the last 2 years of our life. So I know that you may be healthy right now and you may run marathons, but we never know what can happen. And it can happen from somebody else's accident. It doesn't even have to be ours. And then something we never thought we'd have to take, now we have to take. So you have to factor this in. Now also, if you know that your health is declining, that you have a number of conditions and they're being treated, then you're probably not going to take less medications. So you probably know already that you're going to take more in the future. So it may behoove you to look at a plan with a larger formulary, that just in case in the future you have to get something prescribed that is actually available for you. Now, there's always ways to if your medication is not listed on your plan, to get an exception for it. It is a process. A doctor has to say that it's medically necessary for you. And then depending on if there's another alternative drug available, you may have to try that one first. It's called step therapy before you get the more expensive medication. But there are exceptions to these rules. So if you feel that you're in one of those and you need to get a medication that's not covered by your plan, you can ask for an exception and it can be added to your personal formulary. And those exceptions usually last for about a year and then they need to be done again. So all of these things can be a factor in how much you pay. And when you choose an option like this, you're usually locked in for 12 months. So you're locked in for a full year And if you chose the wrong one and now you're paying hundreds of dollars in medication fees, you might be real upset. So take your time, evaluate all of the factors that we just spoke about, and if you need help, seek help. We are absolutely free here at Vista Mutual Insurance Services. We can break down your individual situation, go over all the health plans, all of your Part D requirements, all of your medications, map out the entire year for you, show you exactly what you'll pay per month so that there's no surprises for you, and even enroll you in a plan, and then service you afterwards, all for no cost to you. So if you're looking to seek help, please look for Vista Mutual Insurance Services. Now, if you have any questions, please put them down in the comment sections. We love to interact with our audiences. And also, please subscribe, hit that like button, and hit that notifications button too. That way you get notified when our new content is out. Thank you so much from Vista Mutual Insurance Services. This is Joe Valenzuela. Have a great day.